Polycystic Ovary Syndrome, commonly known as PCOS, is a hormonal disorder that affects women of reproductive age. The condition mainly affects the ovaries, which are the reproductive organs responsible for producing and releasing eggs, as well as hormones. In women with PCOS, the ovaries produce higher than normal levels of androgens, which are often referred to as male hormones. While all women produce androgens, having too much of them can disrupt the menstrual cycle, cause unwanted hair growth, and lead to many other symptoms. Normally, each month, your ovaries are supposed to release one egg during a process called ovulation. This is how pregnancy can happen. However, when you have PCOS, instead of releasing one egg each month as they should, your ovaries develop many small, fluid-filled sacs, called cysts. Each of these sacs, or follicles, contains an immature egg, but these eggs never fully develop or get released. This is why women with PCOS often have irregular periods or miss periods altogether. Other than that, PCOS also involves issues with insulin resistance, where the body doesn't use insulin effectively. This can lead to weight gain, difficulty losing weight, and an increased risk of type 2 diabetes. The name polycystic refers to these small, fluid-filled cysts that can form on the ovaries. However, not all women with PCOS have these cysts, and having cysts doesn't necessarily mean you have PCOS. It's important to note here that PCOS is incredibly common, affecting about 1 in 10 women of reproductive age worldwide. That's roughly 116 million women globally. Despite its prevalence, PCOS is often underdiagnosed or misdiagnosed, leaving many women struggling with symptoms without knowing the cause. In fact, studies suggest that up to 70% of women with PCOS remain undiagnosed. This is partly because the symptoms can vary widely and are often mistaken for other conditions. Causes of PCOS. The exact cause of PCOS isn't fully understood, but several factors play very important roles. Number 1. Insulin resistance. Insulin is a hormone that helps your body turn sugar from food into energy. In PCOS, your cells don't respond normally to insulin. This is called insulin resistance. As a result, your body produces more and more insulin to try to keep your blood sugar levels normal. These high insulin levels trigger your ovaries to produce even more male hormones, creating a cycle that makes PCOS symptoms worse. Number 2. Genetics. PCOS often runs in families, suggesting a genetic component. If your mother, sister, or aunt has PCOS, you may be more likely to develop it. Number 3. Hormonal imbalance. High androgen levels are both a cause and symptom of PCOS. In PCOS, the ovaries produce an abnormally high level of androgens, which interferes with the growth and release of eggs during ovulation. This leads to irregular or absent menstrual cycles. Number 4. Inflammation. Chronic low-grade inflammation is common in women with PCOS. Inflammation can increase androgen levels and contribute to insulin resistance. Factors like poor diet, stress, and environmental toxins can all contribute to inflammation. Symptoms of PCOS. PCOS can manifest differently in different women, but here are the most common symptoms you might experience. Irregular periods are often the first sign. You might have fewer than 8 periods per year, very long cycles, or unpredictable periods. Some women stop having periods altogether. Excess hair growth is another symptom that affects about 70% of women with PCOS. This isn't just regular body hair. We're talking about thick, dark hair growing in places where men typically have hair, like the face, chest, and back. While some women experience unwanted hair growth, others may notice thinning hair on their scalp. This is also due to high androgen levels, which can shrink hair follicles and lead to hair loss. Acne is also very common, especially on the face, chest, and upper back. This acne tends to be more stubborn and harder to treat than typical acne. Many women with PCOS also struggle with weight gain, particularly around the abdomen. Insulin resistance makes it harder for your body to use glucose for energy, leading to fat storage and difficulty losing weight. Some women with PCOS also develop dark, velvety patches of skin, especially in areas like the neck, armpits, and groin. This is often a sign of insulin resistance. Finally, because PCOS disrupts ovulation, it can make it difficult to get pregnant. In fact, PCOS is one of the leading causes of infertility in women. Diagnosis of PCOS. Diagnosing PCOS can be tricky because there's no single test for the condition. Instead, doctors use a combination of symptoms, physical exams, and tests to make a diagnosis. Your doctor will start by asking about your symptoms, menstrual cycle, and family history. Be prepared to discuss any issues with irregular periods, weight gain, or unwanted hair growth. During the exam, your doctor may check for signs of PCOS, such as acne, hair growth, or darkened skin patches. Blood tests are often performed to measure hormone levels, including androgens, insulin, and thyroid hormones. Your doctor may also check your cholesterol and blood sugar levels, as PCOS is often linked to metabolic issues. An ultrasound may also be used to examine the ovaries for the presence of multiple cysts and assess their size and shape. To be diagnosed with PCOS, you typically need to meet two of the following three criteria: irregular periods, high androgen levels, and polycystic ovaries on an ultrasound. Before we continue, if you have been finding the video helpful so far, hit the like button and don't forget to subscribe and hit the bell icon so you don't miss more videos like this. Treatment for PCOS. While there's no cure for PCOS, the right treatments can help manage symptoms and reduce the risk of complications. Here are the different treatment options. Number 1. Lifestyle changes. The foundation of PCOS treatment often starts with lifestyle modifications. This involves adopting a balanced, nutrient-rich diet that focuses on whole foods, lean proteins, and plenty of vegetables. Regular exercise is crucial. Aim for at least 150 minutes of moderate activity per week. Even a modest weight loss of 5 to 10% can significantly improve symptoms. It's important to make sustainable changes rather than trying extreme diets or exercise programs. Number 2. Birth control pills. Hormonal contraceptives are often prescribed to regulate menstrual cycles and reduce androgen levels. These medications contain estrogen and progestin, which help decrease testosterone levels and reduce symptoms like acne and excess hair growth. They also protect the uterine lining from abnormal growth. Your doctor will help choose the right type based on your specific symptoms and medical history. Number 3. Anti-androgen medications. Medications like spironolactone can help block the effects of androgens and reduce symptoms like excessive hair growth and acne. These medications often take 6 to 12 months to show full effects. It's important to note that these drugs can cause birth defects, so effective contraception is necessary while taking them. Number 4. Metformin. This diabetes medication can help improve insulin resistance in PCOS. Metformin works by making your body more sensitive to insulin, which can help regulate periods and support weight loss efforts. It might also help reduce androgen levels and improve fertility. Side effects can include nausea and diarrhea, which usually improve over time. Number 5. Fertility treatments. For women trying to conceive, several options are available. Clomiphene is often the first choice, helping to stimulate ovulation. If clomiphene isn't successful, injectable fertility medications might be recommended. Some women might need more advanced treatments, like IVF. Your doctor will create a personalized fertility plan based on your specific situation. Number 6. Hair removal treatments. Various methods can help manage excess hair growth, including laser hair removal, electrolysis, waxing, or topical hair removal creams. Laser treatment and electrolysis provide more permanent results, but require multiple sessions and can be expensive. Your doctor can recommend the best options based on your hair type and growth patterns. At the end, while PCOS is a chronic condition, it's manageable with proper care. Many women with PCOS go on to have healthy pregnancies and manage their symptoms successfully. Now, we want to hear from you. Have you or someone you know been diagnosed with PCOS? What has your journey been like, and what strategies have worked best for managing the symptoms? Share with us your experiences and opinions in the comments below. We love to hear them. Thanks for watching.